like I was introduced, I'm Dr. Akpochafor Michael, and I'm the Chief Medical Physicist at Marcel Root Cancer Center, a private cancer center in Lagos, and also a senior lecturer at College of Medicine, University of Lagos, where I'm the coordinator of Medical Physics program, where we run an MSc program currently. So what we look at is what does physics do? You know, back then when we study physics, everybody believes that when you study physics, you probably end up as a secondary school teacher or some other type of profession. But we get to find out that physics is beyond just being a teacher. You can actually end up in the hospital terrain where you become a medical physicist. And within the hospital, medical physicist is applied. The principle of physics are applied in making sure that patient gets the right treatment when they are diagnosed with diseases such as cancer. And even in diagnosis of those diseases, medical physics principles are also applied. And this is very, very important because the only person that really knows much about the characteristic of radiation is the physicist. So who is a medical physicist? We'll talk about medical physicists, of which my colleague has explained to you formally, as a person that applies the principle of physics in the diagnosis and treatment of diseases, and also to ensure that there is safety in the use of radiation within the hospital or outside the hospital. Then we look at level of medical physics. Just having a university degree is not enough for you to be qualified medical physicist, just as explained by Mr. Lukman. You have to undergo a residency program to be certified. And that's where we have this structure called the qualified medical physicist. So a qualified medical physicist is somebody that is competent to practice on its own without any supervision. So for you to be able to get to this level of medical physics, you should have, of course, gotten your degree in medical physics. In some country, medical physics pathway is a bit different from what we practice here in Nigeria. For example, in Europe and some other countries, there are certain institutions that have medical physics in the undergraduate level where you have BSc in medical physics. And then you can then go straight into the residency program, 2 years or thereabouts, and then you can be a qualified medical physicist. In Nigeria, the pathway is you have to have a BSc in physics, then an MSc in medical physics, and then you can then have your clinical training or residency program, as the case may be, for you to become a qualified medical physicist. So we have a peculiar situation in our country, which is different from what occurs in every other country. At the moment, we don't have certification board yet in Nigeria because we don't have a board of medical physics. But what we do is when people go through the MSc medical physics, we allow them to go through some form of internship in the hospital for a period of a year or thereabout, and after which they can then be certified to work within the hospitals. So our association, which is the National Association of Medical Physics, which is the guys hosting this program, are very, very key to having everyone ready for the clinical work at the hospital. So their certification is enough for now. So maybe in the future, when we have a board, we can then go into we used to have a residency program that we started back then in 2012, but funding becomes a problem for it. However, we hope in the future we could resuscitate it and then get it running again. So like Mr. Lukman also said, you can also get certification from international body, like the IOMP. They have a very fantastic one that they are running, you know, that you can register for, write the exams and get certified. So the areas of responsibility for a medical physicist include the clinical, the research, the education, and the regulatory compliance. These are some of the areas you are likely going to find yourself if you are a medical physicist. So for medical physicists in the clinic actually, if you in Nigeria, the majority of the jobs currently for medical physicists are shared between the clinic and the education areas. The other areas are still being developed, but you are likely to find more jobs within the clinic area and the educational area. So the primary role of the medical physicist has to do with optimization of radiation dose. When we talk about optimization, we're talking about some of those things that Mr. Lukman has talked about, like treatment planning, quality assurance of the machines, you know, checking the patient charts, making sure treatments and everything is done properly. So those are part of the rules and the jobs of the medical physicist. So you also have medical physicists that are certified in the radiological physics, just like Dr. Yubus has said. In Nigeria, we have diagnostic physicists. So we have a lot of radio diagnostic centers within the country. And currently, they do employ physicists as their diagnostic physicists. So beyond that, I'll also tell you, most of those diagnostic centers, like the government-owned ones, have residency program for radiologists. And as a result, one of the criteria for accreditation of such centers for such type of residency program is for them to have a medical physicist that will be training the radiologists in physics. So because of this drives most of those centers to employ medical physicists. I worked in one of those government centers as a diagnostic physics for some years, where I was lecturing and training the radiologists on the safe use of diagnostic equipment. So there is that prospect within that area. You also have the nuclear medicine. Well, in Nigeria currently, nuclear medicine is just something that is just coming up. Okay, it's not that it's not coming up, but some more centers are getting interested in it. We used to have about 2 to 3 centers in nuclear medicine available, but now we are beginning to have 1 or 2 centers that are making plans to, you know, acquire some nuclear medicine facilities. Like my center, for example, we are planning before the year runs out, or between this year and next year, to also have one of the nuclear medicine facilities. So it's a very lucrative area that a medical physicist can also work, and very, very technical and brilliant field. So in a nutshell, the medical physics clinic disciplines, you could split them into the therapeutic medical physicist, which is the oncology physicist that works in the radiotherapy department, that does things like treatment planning, quality assurance of the machine, okay, things like commissioning of the of new machines, setting up of treatment protocols, training of staffs, and so on and so forth. Okay, so actually the oncology physicist is like the backbone of the radiotherapy department, because you virtually set up almost every aspect of the department that is required to start treating patients. Then you have the radiology aspect, which has to do, that can be split into the 2 parts. The nuclear medicine department that has to do with physiological imaging. Physiological imaging are images that require injection of radiation into patient's body, and then trying to locate the area of disease using those radiation by placing those patients on heavy machines. We have, example, the gamma camera. We have positron emission tomography, which we call PET, and then we have SPECT process. So like I said, nuclear medicine is coming up, and there are centers that are acquiring some of these machines at the moment. So it's a very good area to go into. And then, of course, the diagnostic medical physics. Diagnostic is actually the centers, a lot of centers. There are so many centers within Lagos alone that you could find a lot of diagnostic center. Every one of us, every little corner, you could virtually find an X-ray center in every little corner of Lagos State. So yeah, very much, and currently, some of the private centers are a bit getting away with, getting medical physicists because of the regulatory body. But we hope, it's our hope that very soon everybody will key in line. Most of the government centers are already, noting the contribution of medical physicists to diagnostic centers, so they're already employing. I have a lot of my colleagues that are working within the diagnostic centers, not only for the quality assurance, but also for training of radiologists within those departments. And then you have the medical health physics unit that has to do with radiation safety. So for this, the medical physicist can also work as a radiation safety officer or a radiation safety advisor. However, you might need to undergo 1 or 2 courses with the regulatory body. In Nigeria, we call it the Nigerian Nuclear Regulatory Authority, organizes a 2-week course for radiation safety officers. So if you have the required degree, you could always register for that course, and within 2 weeks, you can become a radiation safety officer. So, which means that you can actually do the job of the health physicist. So you can within that framework, you can also register if you are a radiation safety. For example, you can also be a radiation safety advisor, and within that, you can be either for the medical or for the industrial. For the medical, you will become a radiation safety advisor for medical centers like cancer centers that require, because that's part of the requirement for licensing of cancer centers. They all must have ROSO, radiation safety officer, and ROS, radiation safety advisor. So you can also do that, or you can also work in industries like oil companies. They do use radiation facilities, or some other industrial facilities that uses radiation equipment can hire you as a radiation safety advisor. So some of the common roles of the medical physicist includes installation, acceptance testing, commissioning of the equipment, radiation dosimetry, which is like the quality assurance, optimization of clinical aspect of diagnostic, quality management, collaboration with professionals, with other professionals, radiation protection, training of clinical staff. This is very, very important, this training of clinical staff. I remember when we started up here, we have a center that majority of the people within the centers does not really know about, because my center is beyond just a cancer center. We have some other departments. So they don't really know about radiation protection and radiation safety and the use of radiation. So we have to train them every week to bring them into that note that we are within a radiation environment and everybody should behave in a certain way. So it is very, very important. Effective communication of scientific, technical, and safety related information to members of diverse clinical staff. We're talking about presentation of reports, scientific reports, and like that within the hospital, outside the hospital, conferences, and like that. As a medical physicist, these are part of your jobs. So for the therapeutic medical physics, which involve the use of radiation in the cure of diseases, so you could be working in external beam radiation therapy, for example, that has machines such as linear accelerators, or you could be working with on-seed sources, that things like brachytherapy and like that. So wherever the place you are working, you have to carry out all those rules that I've mentioned above. So this is just an image just to show you some of the areas where you can work within the therapeutic environment. So you could work within the brachytherapy. There are centers. Okay, for example, we have a center in the country that has only brachytherapy machines. So you could work within that center as a medical physicist, and you have to be very well trained in the use of on-site sources and all that, and treatment planning and quality assurance and everything that has to do with the machine. Or you can work within centers that has linear accelerator, like my center, and every other centers, and you also do similar jobs, So for therapeutic medical physicists, some of the peculiar rules involve shielding, installation, design. So right from when they're about to buy the machine, they have to consult a medical physicist. The medical physicist has to be involved in the shielding and the design of the room where the machine will be kept, which is called the bunker. Acceptance test and commissioning of the equipment. You have to carry out acceptance test. That means after the engineers have installed the machine, you have to, you have to carry a certain test to ensure that it is within the specification that is being given by the manufacturers. And then commissioning has to do with measurement of data that you require for the lifespan or use of the machine. So you have to carry out all that. Quality management or physical and technical aspect, you have to carry out quality assurances. You have to put together a quality management team. Usually it is headed by the physicist can head it, or the head of the department can head this quality management team. And the physicist plays a very big role in this quality management team. Development of QA, quality assurance programs, and QC programs, training, supervision of protocols, risk assessment and management, supervising repair and maintenance, radiation dosimetry. So these days, medical physicists job is beyond just doing treatment planning and quality assurance. So you actually do a lot. In my experience, I got to the level where the machine we had, we are always having 1 or 2 technical faults, and most times when you call for the engineer, it takes another 2 to 3 hours to get the engineer on site. So I had to learn how to fix most of these little technical faults, so that we don't always delay treatment of patients, because you could have a lot of patients waiting and you have a technical fault that easily a physicist can fix. If you don't know that, then you have to be waiting for the engineer, and then you delay the treatment period of those patients. So physicists go beyond just the normal stuff that are being done. So there's a lot of responsibilities that are being placed on physicists. So for the diagnostic medical physics, application of physics in obtaining optimized and quality image while ensuring the safety of the patient and that of the personnel. So for this particular field, it's easy for a physicist to just say, okay, I'm here to do quality assurance alone, and then I leave, or something like that. But as a physicist working in a diagnostic environment, you have to do beyond that. I had the experience of working in a diagnostic facility for a period of 5 to 6 years, and within this period, when I first got to the facility, my work was what is really my job, because the role was not clearly defined. So I had to. So the little roles I could find was, okay, quality assurance, okay, do radiation protection, leakage measurement around the whole facility to see if there is any radiation leakage from anywhere. But beyond that, what else? Okay, I started training the radiologists, giving them lectures every now and then. But it was still not enough, because I really wanted to put myself inside the job of the diagnostic. What did your radiologists, what are they looking at when they see the images? What did they want to see? What do they want to do? So I have to start collaborating with the radiologists, start to look at what they are doing. I also had to mix up with the radiographers that are taking the imaging and see the parameters that are using. Okay, why are they using these parameters? Can I bring up optimized parameters? If they are using, 120 kV, 70 MA for a certain imaging, can I do something about it? Can I make a better parameter that will give a better image quality with less dose to the patient? So immediately I start asking those questions, I start finding myself relevant in the diagnostic environment, So we got to a point where some of the radiologists actually started calling, please, Mike, come and see this main image. I can't see this very well. So you become more or less like an advisor to the radiologist when there are certain issues, and also to the radiographers, you know. So you play more than the role of just quality assurance. So you could really do more within the diagnostic. And once you've put yourself, once you've taken interest in the image that the process and the quality of the image, and you have put yourself in that position where you know you can actually do something about having a better quality image with less dose to the patient, you will be accepted once, you will be accepted fully into that environment. Because it's good enough to have your certificate, it's good enough to get certification and everything, but working within the environment, there is a little bit of more, should I call it politics or whatever, that it is difficult for them to accept the medical physicists within diagnostic environment, especially in Nigeria. Maybe elsewhere it's a bit easier, but in Nigeria it's a bit difficult. In radiotherapy, yes, they know they need you, so they have no choice, they have to accept you. But in diagnostic, oh, what is this guy coming here to do? What is his job? He's just coming here to sit in front of the computer all day. But once you make yourself relevant by, you know, educating yourself, getting yourself involved in the work they do, sit with the radiographers while they are taking the image and see exactly what they do, you'll be able to prefer more better solutions to what they are doing. So some of the diagnostic, in fact, the most commonly one is the X-ray machine, you know, and then of course every one of us know about the X-ray machine, and then of course this computer tomography, otherwise is this called the CT scanner, which is also very, very common. A lot of centers are available in Nigeria. You have a mammography machine that's used for breast imaging. So most of these machines are very much available within the country. And as time goes on, they will know that there is a need to actually employ a medical physicist within those facilities. So physics is applied in diagnostic, like we have already discussed. You can work in any of these centers. Beyond the radiation centers, you have MRI centers and so on and so good. So you can fit in within these centers. So some of the roles involve safe and effective conduction of diagnostic procedures, radiation dosimetry and image quality, monitor radiation safety. So once you are employed in diagnostic center, most cases, one of the things that will come to your mind is that you have to play a role of the radiation safety officer. In most cases, you will have to. The thing in Nigeria is that the radiographers can also train to become radiation safety officers, you know, so you now have a situation where the radiographer can become the radiation safety officer of the center. But in most cases, the medical physicist is more appropriate for such type of role because you know more about the quality assurance and the safety aspect and everything of the system more than the radiographer. So that tends to be a little bit of here and there, but once you get yourself involved, you can do the 2 weeks Nuclear Regulatory Authority training, and then you become certified as RSO, and of course you become RSO to the center. So beyond the clinical aspect, you can also do the safety side. So developing and performing necessary QA and QC program, periodic evaluation of imaging modalities. So you have to evaluate your imaging modalities to make sure that they are working appropriately. So nuclear medicine field is a very classic field. I call it classic because it's a nice field that not many people are going into it. So it's still there, it's still involving. In Nigeria currently, like I said, we have a lot of centers that are thinking of going into this route of nuclear medicine. So a physicist is surely needed because we are using sources on sealed sources here. There are likely to be issues with radiation incidents. So a physicist works within this center. So the application of physics entails the use of radionuclides as well as the equipment associated with the procedure in order to obtain a quality image. So we're also talking about quality image. You're likely to be working with computer image quantification algorithms and all that, because most of the work within the nuclear medicine department is to see how you use algorithms to make images much better, because these are physiological machines, which means that the anatomical view of the images from this are not so good. So, however, in this day, in most cases, they don't manufacture these machines as a standalone. They are manufactured as combined to CT scanner. For example, the positron emission tomography machine, the PET, no longer comes as a PET machine alone. It comes as a PET CT. So you have the CT side and the PET side. So as a physicist, it's your work to, apart from the quality assurance aspect of it, because you have to do a quality assurance on the machine and also the radiation sources that will be injected into the patient. So you have to do measurements. So these aspects are very, very important. So you have to develop protocols, you have to develop QA programs to be able to, work in these areas. So this is what I'm just trying to tell you, like their physiological machine. This is a gamma camera, typical dual head gamma camera, so but in this field, patients are injected with radiation sources. The patient begins to emit radiation sources. The patients are placed on the machines, and then the machine determines the location of the radiation sources, where the sources are, where these radiations are coming from. For example, this machine locates, gives the location of the gamma rays, where they are coming from within the patient. And usually, any part of the patient that has high metabolic activities, such as if the patient has a cancer, you are likely to have a high metabolic activity within that organ or tissue. So most of the radiation will likely settle in that area where you have high metabolic activity. So that can easily be detected. So you will find that area radiation coming from those areas. So for this type of studies, if a patient wants to undergo this type of imaging, usually the patient will be asked not to do any exercises, maybe 1 hour or 2 hours before the time, or so that you don't have radiation settling in other areas, because if you do exercises, you will have high metabolic activities in other cells, which you don't want. So usually in the morning, after good sleep, patient can be injected and then given some time for those radiation sources to settle down in the disease area. And then the machine, there are detectors to detect those radiation where they are coming from. So some of the responsibilities within the nuclear medicine department include shielding and installation design. So shielding calculation is usually done by the physicists, optimization of physical aspect of diagnostic procedure, gamma camera, SPECT, single. So SPECT is not a machine, it's not an equipment, but it's a procedure for creating a 3D images from the 2D image that was gotten from a gamma camera. So it's a tomographic process. Tomography means slices. So it can take your 2D image and create it in 3D format. So then you have your PET also, which is a 3D imaging system. So the rate of quality assurance program and QC, those using detectors and all activity measurement and those calculation, development of institutional protocols and procedures, ensuring compliance to protocols and procedure. Then training. Training is very, very, very important. It is the job of the medical physicist to do majority of the training. Then the other aspects you likely also get into is the medical health physics aspect, which is like health physicist aspect. So this entails the safe use of radiation of charged particles, radionuclides, or such as X-ray, gamma ray, neutron, and the rest of them. So it's all about safety. We talk about the principle of radiation protection here. So everything that you do is how to use the safe use of radiation. So in this area, you get trained to become a radiation safety officer and later a radiation safety advisor. and then you can work in the hospital as a radiation safety officer or radiation safety advisor. So usually the radiation safety officer are domiciled within the hospital, while radiation safety advisors are, usually individuals that have been certified by the regulatory body. They come in once in a while to make sure that the safety, all the safety norms within the hospitals are being adhered to. And then they usually work hand in hand with the ROSO, the radiation safety officer. So the medical health physics is associated with all the clinical subfield of medical physics, such as therapeutic, diagnostic, and nuclear medicine, just as I've said. So ROSO and RSA, they work in all the departments, whether it's nuclear medicine, radiotherapy, or diagnostic. And they can also work in the industry, like I have discussed. For like radiation safety advisor, they can work in oil companies that have radiation facilities or some other industries. So some of their roles and responsibilities include overseeing shielding and installation design, periodic survey of facility using necessary equipment, like we have a detector called a survey meter. You have to do leaking tests, responsibility for decommissioning of sources. If radiation sources are no longer being used, these are the guys you will have to call. Radiation safety for program, for personnel, comforter, as well as public. Ensuring safety in any routine or facility that involve use of radiation or application of physics in general. So any environment, any company, any industry that has to use anything that has to do with radiation normally should have radiation safety officer or radiation safety advisor, including the airport, where they use scanners, all those radiation scanners for scanning. They should have at least a radiation safety advisor that comes once in a while to do some measurements. Some years ago, we did some research in an airport, and we find out that a lot of the guys within the airport they were sitting close to the scanner without any form of shielding and all that. And we had to now advise them after taking some measurements on where they should sit and where they should not probably sit. So things like that are very important, and they are job for radiation safety officers or safety advisors. So research and development, very important. This is a non-clinical setting where medical physicists are present in disease centers and research institutions. Currently in Nigeria, we don't really have so many of these type of institutions, but in abroad, you could find some of them that are people looking for research assistants and research officers and things like that. So radiation safety, medical physicists can work in such centers. So as a research medical physicist, you can work primarily on issues involving radiation, which include radiation-induced biological alteration mechanism, implantation or integration of cutting-edge treatments and procedure. You can any research that has to do with radiation at all, a medical physicist will be the best person to work as a research officer in such type of centers. Then in the academic is one of the areas that employ more people, more medical physicists. As a medical physicist with MSc, you could work in the university as a university lecturer. You could work within the environment. In fact, it's one of the, I wouldn't say easy, but it's one of the likely place you could quickly get a job when you are trained as an MSc medical physicist. Then a medical physicist in the regulatory practice, within the regulatory body, you can also work as a medical physicist. Majority of them recently, we had some attachments from the regulatory body to my center, and they learned quite a lot about the job of the medical physicist, because you need to know what the guys that you want to regulate are doing. Otherwise, what questions are you going to ask? So to me, the medical physicist is the best person to employ in these regulatory bodies, because as a medical physicist, you will know the right questions to ask when you go to visit centers during regulatory functions and all that. So there are jobs. And then we have the SSDL. The one in Nigeria is located in University of Ibadan. So they have a cobalt machine for calibrating ionization chambers, which are detectors used in the hospital. So the medical physicist is the best person to work in such centers because he could do all those quality assurance, do all those calibration once you are well trained. So some of the credentials of the medical physicist, like I said, in some other countries with BSc, they could go straight into their residency program, but in Nigeria, MSc is a prerequisite. So for a medical physicist, BSc in physics, and then some schools, they have some hybrid program that they do such that even if you don't have BSc in physics, you could do a kind of a postgraduate program that will now allow you to go into the MSc program, you know. So some schools do practice that, MSc or PhD in medical physics, undergo an internship in some field of choice, get necessary certification from country board, you know, and so on and so forth. So the medical physicists can be employed in medical schools, hospitals, research institute, university, radiation regulatory bodies such as Nigerian Nuclear Regulatory Authority, industries that involve the use of radiation. So in summary, where can you find work? So the likely areas you find work if you are a medical physicist within the radiotherapy centers. Currently, we have both the public and the private centers. Really, there is a lot of interest in radiotherapy. A lot of private centers are coming up, like my own center. There are so many other ones that are coming up. I already know some of them are building their Balkans. They will definitely need medical physicists, and there are not enough in the country at the moment. There's no diagnostic centers. We have both in the public and the private. Most of the public ones are beginning to employ medical physicists because they know medical physicists is important for the training of their staffs, such as the resident radiologists and some of the radiographers that are training. So they are beginning to do that. Some of the privates are probably not employing medical physicists as full-time, but they are employing as part-time. I've worked as part-time with a private center in Lagos before that was looking for a license to practice, and they needed somebody to do some radiation safety officer work, and I had to go there to do some of those work. So some of them are beginning to see that. Then the nuclear medicine center, like I said, some of the centers are coming up. We have some of the public centers. We have in Ibadan, UCH, where National Hospital Abuja have one also. Then we have some privates that are coming up. Mekio is the one that just installed a PET CT, so which is a good way to go. And Evercare, I understand Evercare also have a gamma camera. So my center is also thinking of getting a PET CT. So definitely we will need more physicists when that happens. So we have a lot of centers really coming up, and one could really get jobs in these places. Then in educational institutions, we have the public and the private universities. It's a bit on the downside because the universities that run medical physics in the country are not so many, really. I don't know why, but at the moment, there are not so many. There are just a bit of few of them that run medical physics program, but some of the private universities are beginning to take interest in the medical physics, and then they have started some kind of hybrid courses on it. You know? So I could give you some of like University of Lagos, where I am the coordinator. We run a 1-year MSc Medical Physics. You have Nasarawa also run, I think it's a 1 year also, medical physics. OAU, Obafemi Awolowo University, also run medical physics. Ibadan, University of Ibadan runs health physics, radiation and health physics, not medical physics. There is a difference between medical physics and health physics. The big difference is that most of the people that do health physics cannot do the work of the medical physics, because to do the work of the medical physics, you need to do a lot of courses such as radiotherapy physics, treatment planning, and da. Meanwhile, most of those courses, you will not find them under the radiation and health physics. However, the person with medical physics certificate can also do the work of the health physics, because you do radiation protection as part of your courses in medical physics, which is majorly the course run in health physics. So some centers, I remember, I think the University of Calabar, some years, I think they have probably started their program and so on and so forth. Then you have the industrial aspects where you can become ROSA, Radiation Safety Advisor, or Radiation Safety Officer. So for any facility within that is producing radiation, a medical physicist can work in that facilities. Then one of the most important one that most times people don't really look at is sales rep. As a medical physicist, you will be the best sales rep for equipment manufacturing companies such as General Electric, GE, that produces a lot of these machines, Siemens, and the rest of them. You know, you can become a very good sales rep for those type of companies. So I have one or two colleagues that work in those places as sales rep. They are trained as medical physicists and they become sales rep. Thank you.